Welcome to the Miro Center for Research and Innovation. Today we have a really tremendous opportunity to view this webinar that is focused on the cost of care, improving outcomes, but also improving the cost of care substantially. My role is just to welcome you today, but also give you a little overview of the innovation program. At the center, we have been supported by the leadership of the health system for some time to bring new therapies to patients and to lead in those new therapies being under clinical investigation require no cost to the patient nor the insurance companies. So we have a clinical research team that's started about 30 years ago, health service informatics team 10 years ago, which receives external funding. Of that team of 26 individuals, 12 are PhD scientists. We have a precision health program, which provides genome-wide sequencing, which will definitely improve the cost of care by predicting disease, and advanced simulation lab to reduce variation in care and improve patient safety, and a innovation program, which brings all these elements together to help external early stage companies bring new opportunities to the health system. Part of this is also supported by our Office of Sponsored Projects, which brings in external funding. But a little history of the innovation program. It started about 10 years ago, at least internally, organically, but what really kicked it off was hiring two key personnel, Ethel Messing, who is a brilliant, she's the Director of Innovation and Strategic Enterprises, and Charlotte Gabbett, who then has formed this wonderful team. We partnered with Matter out of Chicago for the past 8 years, and there's five competitions that have been held. This is the fifth competition. The first was on infant mortality, focused on that. We brought teams from all over the country, and very quickly, the next year, we had maternal mortality a focus and brought teams internationally as well. And then the fourth competition was, or the third competition was maternal infant health, and the fourth competition was on pediatrics. And this is the fifth competition, the cost of care. I have the privilege of introducing everyone, but we have faculty and students from Butler University, which are a key element of this team. And the brilliant Pat Sullivan from Hylant, who's a genius in providing opportunities for employers to drive the cost of insurance down, but at the same time, bring value to the companies as far as improving employee health. As all of you know, the cost of care is a tremendous challenge for not only patients, but certainly employers. Employers really want their employees to be healthy and maintain a good health span so that they would remain working for a long time. The only way to do that is with preventative care. And a lot of the elements within the industry do not necessarily promote the best of preventative care. And so the employers frequently have to deal with this. And actually, I already touched on the precision health program, which will go upstream in care, predicting what we call tier 1 CDC mutations, which would identify propensity genetically for high-risk diseases that could be prevented with screening. Of course, we want to collaborate with innovators from not only in the United States, but around the world. And this team, led by Ethel, has been really remarkably successful at helping young innovators in the field of life sciences bring new solutions, not just drugs and devices, but also software and other solutions to improve the process of care. So with that, I want to welcome all of you, and particularly those of you that are interested in driving the cost of care down, but also improving health outcomes and extending the life of patients. Thank you.
Great. Thank you so much, Dr. Miro, for that energizing kickoff and for grounding us in the purpose of this competition. It's clear to hear how impactful this effort for our healthcare systems and our communities. So thank you for that. My name is Stephanie Henshaw. I'm with Butler University, and I'm pleased and honored to be the moderator for today's session. So it's my goal to guide us through the rest of the event. Real quick run of show for everybody, just so you can understand, who's going to be speaking as we progress throughout the time together. First, we're going to start off from hearing from Butler University about the data challenge. So we're going to actually get to hear some from faculty and students. It's going to be really exciting. Then we're going to hear from both Parkview as well as Hylant to talk through why, innovation is so important when we think about total cost of healthcare. We're then going to transition back to Butler to talk about, why Butler is involved with this and the support that Butler is also going to be providing during the accelerator. We'll then transition to hear from somebody who has participated in one of those past Parkview accelerators. After that, we'll hear from Ethel herself. Dr. Mira just alluded to how wonderful she is, and she's going to walk us through the exact accelerator challenge. And then we're going to wrap everything up. So that's a quick run of show, and looking forward to guiding you through that. So to get us going, as promised, we're going to start off with talking about how Butler got involved from the front end of it and hear from some of our wonderful faculty and staff. So earlier this year, Butler University students actually participated in a data challenge that explored the total cost of healthcare across Indiana. What they basically did is their goal was to uncover insights that shape the foundation for today's innovation challenge that we're launching. So we're going to hear about the findings and what they discovered, which again is rooting this innovation challenge. So I'm pleased to be joined by the winners of this competition. I have Shams Parkour. He's a sophomore at Butler University studying neuroscience. Chris Borse, an MBA student at Butler University. And then their faculty advisor, Dr. Jason Davidson, assistant professor of management information systems. So welcome. First of all, congratulations on the win, you three. We're excited to hear about what you learned during this data challenge. So to kick us off, Jason, Chris, and Shams, would you mind walking us through the total cost of healthcare data challenge that your team participated in this year?
Sure. Thanks for the introduction. Hello, everyone. My name is Shams Parkar, and I was interested in joining the Total Cost of Healthcare Data Challenge because I saw how cost barriers prevented patients from receiving the healthcare treatment they needed during an internship. I was motivated by this experience to explore what factors contribute to the large cost burden of our healthcare system. Since the U.S. elderly population is projected to grow significantly in the coming years, we were interested in how treatment for this population could be contributing to healthcare costs. After reviewing the literature and speaking with friends, we found that elderly falls were a common but underemphasized contributing factor to healthcare costs. For example, while some elderly falls may not cause long-term complications, one study showed that almost 88% of hospitalizations and emergency department visits for hip fractures among elderly adults aged 65 and above were a result of a fall. In addition, there were several comorbidities associated with prolonged stays in hospitals, such as a risk for pneumonia or DVT and long-term mental health issues post-fall. Clearly, we saw potential to address this issue. Though I had limited experience in data tools, I took advantage of our studio and my knowledge of statistics to look at mortality rates between rural and urban counties, while my colleague, Chris Forsey, looked at the actual costs associated with elderly falls. I utilized publicly accessible data sets to the NIH to compare elderly fall mortality rates of rural and urban counties in Indiana. While we didn't see a significant difference in the mortality rates between these two groups between 2017 to 2023, we did find a slightly higher mortality rate among rural counties. In addition, a few individual rural counties had significantly higher mortality rates compared to Indiana's or the nation's rate of mortalities from elderly falls.
Great. Thank you for sharing that. Such valuable insights. So just kind of following up on that, and thank you again for the great work you've done and being able to really analyze this data to be able to, again, have a foundation for this innovation challenge. So Shams, Chris, if you could share a little bit more, and perhaps you hit a little bit on that already, but I want to make sure that the group listening to this can really hear it. Can you share a little bit more about any key insights that you discovered and or what you feel is the most important points for people who are going to participate in this innovation challenge, what they should know?
Yeah, thanks, Shams. As mentioned, the senior population in the United States is growing. It's referred to as the 2030 problem in a lot of literature. For Indiana, we estimate that the over 65 population will grow by as much as 33% between 2023 and 2033. Now, this demographic consumes the most healthcare and represents the highest cost. As Shams mentioned, nationally, 1 in 4 seniors experience a fall every year. And in Indiana, it's a little bit worse than that. It's 30.8% of seniors experience a fall. And falls contribute directly to healthcare costs through ambulance rides, emergency room visits, imaging, hospitalizations, and increased hospice and home care. But they also contribute indirectly by early onset and exacerbation of chronic conditions such as obesity, diabetes, cardiovascular disease, and even some cancers. Nationally, 1 in 4 people over 50, only 1 in 4 people get the recommended amount of physical activity for the prevention of chronic conditions. And for seniors who experience a fall, their physical activity is much worse than that. So we created a calculator to estimate the amount of savings that Indiana could achieve if we could prevent falls through a fall prevention strategy. And we estimated that in 2033, $119 million could be saved annually if even half of seniors received a physical therapy fall risk assessment every year, and 41 deaths would be prevented. Shams, did you want to add anything there?
No, I think that's perfect. Thank you.
Wow,
Okay.
those numbers are staggering. I don't know about you, but I've definitely, had people in my life that are elderly that have had a fall. And then after that, there's been lots of, consequences after that. It's interesting to see those numbers bear out in such a profound way and how preventing at the root cause can really save that many lives, as well as potentially being able to save all those costs for healthcare. So thank you for sharing that. Anything else that you all would like to share with this group about the innovation challenge that you think that they should consider from your findings?
Yeah, I would just add that, our calculator relies on data from the Indiana All-Payer Claims database, and the assumptions around utilization that result from falls come from published studies that we analyzed. And the calculator that we built allows the user to change those assumptions based on different scenarios. And you can even change the number or the percentage of seniors that are screened or the number of falls that are prevented. But the key thing there is that we would love to be able to associate all the claims with the mechanism of onset as falls, but that wasn't available in the data set. And I emphasize that just to say that whatever people decide to tackle in this challenge, as long as you can get evidence of a strong cause and effect relationship between the conditions and the cost, you'll get a more compelling solution.
Great. Thank you for that, Chris. Very cool calculator. Anything else to add?
Stephanie, this is Dr. Miro. Can I add a question for Chris?
Of course.
So, Chris, by the way, my background, I'm a cardiac electrophysiologist, boarded, but also in geriatrics. We have taken care of a lot of elderly patients. You're spot on about observation on falls and the cost. Of course, that's the Medicare costs, which, as you know, the federal government has underfunded Medicare. So hospitalizations are underfunded. So that ends up in cost shifting to the commercial payers, which is part of the problem. And obviously, the only way to fix that is to have preventative care for the elderly. And that's part of the trend towards Medicare Advantage. Do you want to comment on that and problems with the Medicare Advantage programs?
Yeah, I think a lot of the problem that you see in the healthcare system is a misalignment of incentives. And so I think there's not much question out in the world about whether falls are a problem and whether they can be effectively prevented with, known things like a fall risk assessment. But again, the payer right now, the pay systems require comorbidities or other things besides just age as a reason for the screening. So not enough people are getting an assessment. And as you point out, if Medicare doesn't want to pay, then Medicare Advantage gets the burden or Medicaid gets the burden. And everyone is trying to shift that cost on a claim level when really, as you look at the data, the cost is the lack of prevention that we're doing. If we did the assessment, we would save much more money in downstream costs. But it's hard for our system to really think that way because not everyone, some people are making money off of those other treatments, and some people are making money by saving on that assessment not being covered without really taking into account the entire picture for the health system.
Thanks.
Great.
Well stated.
Thank you. Wonderful. And that's a perfect segue to our next speaker. So first of all, thank you very much, Chris and Shams, for sharing your findings with us. And congratulations, Jason, for being a faculty advisor. Very impressive work from the Butler team. So with that, we actually are going to transition, like I said, perfect question from Dr. Mira to be able to transition as well from the healthcare system perspective. So I'm very pleased to welcome Dr. Jason Rowe. He's the Chief Value Transformation Officer at Parkview Health. He's here to share with us his views on innovation and prevention and why they're critical to sustainable healthcare. So welcome, Dr. Rowe.
Thank you. Pleasure to be here.
Wonderful. Thank you. So I'm going to start off with a really large question that I'm sure could go lots of different ways. Are some healthcare costs preventable?
Yeah, the quick answer is absolutely. There are a lot of healthcare costs that are preventable. The U.S. spent a staggering $4.9 trillion on healthcare in 2023. That's over $14,000 per person. And when we look at how much of that can we affect as a healthcare provider, the biggest chunk is hospital stays. About 30% of that $4.9 trillion was spent on hospital stays. And research has shown that up to 13% of hospital stays are actually preventable. So that would reduce our amount of hospital stays by 3.5 million per year, resulting in around $34 billion of savings. So I think if we're going to try to reduce the preventable costs associated with healthcare, the low-hanging fruit from a healthcare provider perspective is going to be reducing hospital stays.
Wow. Thank you. Those numbers, even though I've heard them before, are staggering. And the one I hadn't heard before that I want to make sure I heard right is 14,000 per person.
About $14,570, give or take, per person, which is staggering.
Yeah, that is, when you put it in that perspective, it just kind of landed a little bit differently. So thank you for sharing those statistics. Obviously, there's a huge challenge here. And I think you kind of alluded to this, but I want to make sure I ask the question directly, is why is it important to reduce preventable healthcare costs then?
Yeah, good question. I really think it's important on at least three levels. When we think about the societal level and that nearly $5 trillion that we spend on healthcare, that's 18% of our GDP, and it's growing at a rate year over year that's twice the rate of inflation. So quite frankly, the healthcare costs at a societal level are just not sustainable here in the United States. If you go a level down to the employers, Dr. Miro alluded to that cost shift that occurs. We know that our employers are bearing a lot of the cost of healthcare for their employees to the tune of on average, $11,000 per employee per year. And so that, essentially it becomes the second biggest line item on many of their expense portion of their income statement after payroll. So it's a big burden on employers, and I'm sure Pat will probably allude to that in his comments later. But then if we take it down even further to the individual level, there was a survey in 2021 that showed that 37% of US adults at that moment carried the burden of medical debt. 37%. When they asked folks, okay, maybe you don't have debt now, but have you ever had medical debt? An additional 23% said yes. That's 60% of our population that was or had been burdened by medical debt. That in and of itself is staggering. And then you layer on top of that the fact that 35% of US adults admit to foregoing medical care because of cost in any given year. So it's really a great burden at each of those levels. And I would add that it's not just a monetary burden, because if we avoid healthcare, then often it means that we're not living the healthy, happy, productive lives that we otherwise could.
Yeah, thank you. I'm continue to be just kind of awestruck by some of these numbers that I'm hearing again. I've heard them before, but hearing them again, it just always lands on me. I think Shams kind of alluded to a little bit of this when he was talking about some of the data that Butler students found, and he and Chris found when they were really reviewing the data in the challenge. But they alluded to really chronic conditions and rural access to impact to healthcare. So do you mind sharing a little bit more about how chronic conditions and limited rural access actually impact healthcare spending and how the outcomes are impacted by that as well, please?
Yeah, happy to. It's just such an important point. So I mentioned the biggest thing that's impactable for us as a healthcare provider with the help of you all as innovators is to try to keep people out of the hospital. So how do we keep them out of the hospital? Well, first, we have to keep them out of the emergency room because that's the front door to the hospital. And when we think about why many folks end up in an emergency room, it really boils down to a couple things. The first is access to other lower cost sites of care. Right. So often people come to the emergency room because they can't get into their primary care provider. They can't get into their specialist. They can't get a test or a procedure done timely. So they end up in the emergency room. Or quite frankly, sometimes it's not that they can't get it done timely, but in this consumer-driven culture, maybe they just can't get it done on their own terms. And so they end up, after hours resorting to an emergency room, which is a much higher site cost of care. So we have to think about access, to your point, and how that comes into play. Access is particularly important at this moment in history because we have a big physician shortage in this country. In fact, over the next 7 years, there's a projected 120,000 physician shortage across the United States. And to your question about rural healthcare, 2/3 of that shortage is in rural areas in America. So this is a current, but sadly a growing problem that affects access. So we need your help as innovators thinking about how we can improve access, even though we can't continue to recruit physicians. So access is a big issue. The other reason why folks often end up in an emergency room is because of complications of their chronic disease. So if we don't do an adequate job managing those chronic diseases, for example, hypertension that's poorly managed can end up as a heart attack or a stroke that hits the hospital. Or diabetes that's poorly managed can end up as kidney failure or a toe amputation, or another complication like diabetic ketoacidosis that hits the hospital. So 90% of that $4 trillion US healthcare spend each year that I mentioned earlier, 90% of that is related to chronic conditions. And so we can't underestimate the importance of adequately managing those things. Last thing I would say, we talked about access, we talked about chronic care management. I think there's a third leg to that stool, and that is risk factors. It's about engaging people, and I think Chris alluded to this earlier. It's about engaging people to manage their own health and make healthy lifestyle choices. We can't underestimate the impact of an individual's choices. For example, tobacco use costs this country in healthcare $240 billion a year. Physical inactivity, $117 billion a year. And alcohol, particularly related to binge drinking, nearly $250 billion a year in terms of its impact on healthcare costs. So we need to engage people, and we need innovative ideas on how to do this to make better lifestyle choices and to manage their health better.
Yeah. Thank you for that, Doctor. I appreciate that. Really kind of sounds like, and always reminds me of something that my dad taught me very young, is the definition of insanity is doing the same thing again and again and expecting different results. We have really big, wicked challenges right now in our healthcare system when it comes to access, when it comes to shortage, when it comes to costs. So as a result, we need to do things differently. So that's where this innovation challenge comes into, and making sure that we're really thinking about innovation. So my last question for you, and you kind of already alluded to it, but I want to make sure, again, I'm asking it directly for you and your perspective and from your lens, which is so broad from the healthcare system. What do you see is the role that innovation can play in improving patient outcomes and reducing healthcare costs?
Yeah, that's great, Stephanie. Thanks. I really liked what you said about we can't keep doing the same things over and expect a different result. I was at a meeting a couple of weeks ago with Dr. Mehmet Oz, the Administrative Center for Medicare and Medicaid Services. And he talked about, he sort of framed it in healthcare as the idea of incumbents and insurgents, right? So those of us who operate in this traditional healthcare framework that we have in this country that's evolved over decades, we are the incumbents, right? And I think we do an excellent job providing care on an individual basis. But in many ways, what's lacking is enough insurgents, because we can't disrupt very easily from the inside. We need innovators and so-called insurgents like yourself to take that out of the box view, to look at the problems from outside the current construct, and to innovate, to get funding, through private equity or venture capital, to really be able to move quickly and to work with the incumbents to be able to engage in transformation. So innovation is key. For example, take access in the physician shortage. We can't recruit our way out of a shortage. And so we have to embrace innovative ideas about how to provide care in the presence of a shortage. How can we engage innovative tools to help with chronic disease management? How can we engage patients better to make better lifestyle choices and to connect them with resources to address their social determinants of health where gaps occur? How can we embrace and leverage AI in healthcare and better enable care at home, because home is the lowest cost site of care of all? So we really need you all in the innovative ideas that you bring to the table to deliver care in the right place at a much better cost than we can today.
Great. Thank you so much, Dr. Rowe. I appreciate you sharing all these insights, and I'm sure the innovators on this call will be thinking about those statistics and what you just said about the incumbents and insurgents. One of the things that we're committed to and definitely use as a design principle is being able to think about how other industries and how other people think about ways to solve problems and learning from outside, which it sounds like that's really that concept of the insurgents, right? So, well, thank you for that. Greatly appreciate it. I'm going to transition, and you actually set this person up well. So thank you, Dr. Rowe, for that, to Pat Sullivan. Pat Sullivan is actually the Executive Vice President and Employee Benefits Client Executive at Hylant. Pat's now going to talk a little bit about what Jason alluded to, but expand much more in depth into this about how the impact of healthcare costs on employers and why engaging in innovation from the employer lens is so important. So welcome, Pat. We look forward to learning from you now.
Stephanie.
Thank
I really do face the things that just got talked about. I've been in the employee benefit space for 30 plus years, and a lot of things that we do haven't changed. A lot of them look very similar to what they've looked like in the past. The real big difference is cost. Is the cost that our clients are dealing with today just is becoming astronomical, and it is probably their second or third largest cost that they pay. It used to be that my meetings were with the employee benefit people or the human resource people, but because the cost has gotten so large, I now sit in rooms with CFOs, CEOs, business owners, because it's such a large issue for them. One of the things that I see as we step back is to see is how fractured the system really is. And actually earlier, Dr. Miro said, is there really a system? And I think, unfortunately, and I'm including myself in this, we're kind of all to blame for this. Insurance carriers, benefit brokers, doctors, hospitals, how we're training people coming out of school. And mostly I'd add into that are the patients, because we're all sort of sitting in our silos. And really the only common connection in all of those pieces many times is the patient. And the system by and large has become, I think, or has been fairly reactive. It was just mentioned, a lot of people that they eat poorly, don't exercise, have bad lifestyle habits. And I think they expect that their health is somebody else's responsibility. And nobody really holds people accountable at the end of the day. And if they're not, nothing really happens in it. Our data analytics that we show on how people use health insurance, less than 50% of people are getting their preventative care. We just talked about that the insurance plan covers it at 100%. So the employee doesn't have any exposure or out of pocket. And yet less than 50% of them are going in and getting their preventive care because they feel okay. They think they're fine. And then they finally do go in and see their physician, and surprise, they've got high sugar levels or they've got high blood pressure. And the doc doesn't have a lot of time to spend with them, and they walk out and now they're in their car and they're thinking, okay, now what? And they're trying to fix 20 years of bad habits pretty quickly. And I think sometimes the farther they get away from that news, the less committed they are to talking about that. And then they end up with a heart attack. They end up with type 2 diabetes, and now they have a chronic condition, and it's going to be expensive. It's going to be expensive for them. It's going to be expensive for their employer. So people live longer, but sort of at what quality? We also know that only about 70% of people are compliance or adherence to what their doctors are recommending. And when the patient's not compliant, nothing really happens. There's no accountability or responsibility. And the only common link between all of this tends to be the patient. The physician can only manage what they know. So when the patient's telling them that they're taking their blood pressure medicine, but at the end of the day, they're really not, it's hard for them to be able to manage it. And what we're seeing today is a lot of technology dollars are getting invested in what I'd call high ticket items. So different testing, medications, and it's not uncommon for us to see somebody in a treatment plan that's running over $250,000 a year. The reason I was excited about this innovation is that as we all sit in our silos, and again, whether that's myself or the insurance company or the physician or the hospital or the patient, that nobody's sitting over the top of it looking down saying, what can I do? We talked a little bit about each of us could have our own interests, and certain people are getting paid certain dollars if things don't happen. But nobody's saying, how do we do this better? How do we connect? How do we knock down these silos and begin to challenge about how do we hold people to be accountable? How do we hold the patient to be accountable? How do we hold the insurance company to do a better job to, set a system up so that the physician doesn't have to manage on kind of defensive medicine? So I'm excited about it. My employers are really struggling in the costs that they're paying. They want their employees to be healthier and better. They want them to be better employees. They want them to be happier. But as it was said earlier, the system we have today is just not sustainable. So I'm excited that we've got somebody taking a 10,000-foot look at what can we do different and what can we do better.
Great. Thank you so much. So much good information on what you just shared. I want to make sure that I can distill and that I understand exactly kind of some of the great information you just shared with us. So it sounds like we've got some really pressing challenges in healthcare. And what I heard from you is that the system itself, if it is a system, is really what's really the challenge of it being so fractured, in the sense that, and it wasn't lost on me, that the patient is usually the only person that's connecting all those disparate systems. So looking for innovation that thinks about things at a system lens, but also combines some of that, is something that I think is a wicked challenge that I think is exciting for you. I also heard you say that really that we've got high tech, or we've got tech solutions, but they're going over the really kind of going after the high ticket items and not necessarily the preventative costs. And that can actually cause a lot of challenges as well, because those preventative costs with only people that are not even doing the preventative care, but then only 70% compliance with even doctors' prescriptions, or I guess doctors' orders, lack of better words, is also causing a lot of these challenges. What did I get right? What did I get wrong? Or what else would you like to add on that? I know I overly simplified all the great information you just shared.
I think you were exactly on, Stephanie, because when we talk about people going to the emergency room, the best claim is the claim that never happens. And so if I see my physician and let's say I was making bad lifestyle choices and I become a type 2 diabetic, my doctor has given me certain guidelines and things to go do, but I'm not really compliant. So now I'm not feeling good, and it's a Saturday night. And so where do I go? I go to the emergency room, and probably not the best place to get care for a chronic condition. And so if I back all the way up, and the claim that never happens, so if I make better choices and I'm proactive in my healthcare, maybe I never become type 2 diabetic. But if I do become type 2 diabetic, if I'm compliant to the direction of my physician, taking my medications, that emergency room visit never happens. And so it just kind of stair steps its way through the system.
Great. Thank you so much for that. That's really, really fascinating. And it sounds like from the employer side of this, again, as it's trying to get to what claim never happens, to be able to get you out of those meetings with the CFO, which is, again, a very interesting transition that now the meetings are taking place at the financial officer level compared to like the benefits because of how high those costs are. So that's why innovation is needed so much from an employer lens. So thank you very
Absolutely.
much, Pat, for sharing all of that with us. That's very important. I think that will help the innovators a lot as they're thinking about solutions. So we've heard from healthcare systems, we've heard from the students, we've heard from the employer partners. I'm now going to transition to academia and our partnership with Butler University. And we are joined by our Butler University Director of Entrepreneurship, Nick Smrelli, who's going to share with us a little bit about his background, as well as then talk about more about why Butler is important, or excuse me, why Butler is excited about this accelerator and how our students will be involved. So welcome, Nick. Good to see you. Do you want to start us off by giving a little information about yourself, your role, and then also why Butler is excited to join this partnership, please?
Absolutely. And again, I'm already 36 minutes into this call and inspired by what potential we have as a collective group to solve for some of these challenges. So thank you so much for everybody so far, and can't wait for the rest of the call. Yes, my name is Nick Smrelli. So I am in charge of Butler's entrepreneurship program, serving students, faculty, staff, and alumni in the creation of ventures that, in theory, solve for big problems. My background is I have two companies that I started, one more of a Main Street consulting business, one more of an innovative tech-focused business. And about 3 years sold both of those and moved to the land of academics with the hope of establishing a foundation for being a part of programs just like this. To me, the beauty of higher education is where before I was the one who was starting the companies, now I have the opportunity to help enable others to solve hard problems and start their own businesses, which is where Butler is getting involved with this in general. So what Butler has and is continuing to build is a platform to help get these businesses off the ground. Collectively, our general thesis is we want to stand out in the community because we're out there solving problems that need to be solved. And I think that's the beauty of entrepreneurship is, again, so much of the business case is presented today of a problem that is really ripe for some real innovation and real disruption. If you look at anybody in any of the kind of the economists in terms of some of our biggest risks heading forward, it really, really is around healthcare. And I want Butler to be positioned as an innovator in the space, solving for real challenges. Yes, I still love the cool tech platforms. I still love some of these other more Main Street businesses. But in a few years, when you hear Butler University, I want you to be considering Butler is really great at solving for big challenges. So why do we get involved beyond just that general thesis? To us, students being involved with this solves for some of the biggest, I think, challenges that we have as a higher education institution. How do we teach students value creation? Part of building a good business is what is the unique value you're bringing to the market? So part of this is having students become involved with the accelerator to help with market research, having students be involved with designing go-to-market strategy, helping students become involved with testing consumer preferences and making sure there's a lot of validity in your argument. The next value for us is this idea of connectivity, is taking things that we're learning in the classroom and then actually applying them. We work with MBA students and our undergrad students to position them to help individuals part of this accelerator to take things that they're learning in finance. We're going to do some valuation and understanding if you're going to go out and raise money, at what valuation should you go at? And you can bring in some of our students to help solve for that, or helping build pro formas. And the last really kind of vision that we have of why we chose to do this is this idea of like building curiosity, is part of this too, is having, students like Kristen Shums get involved with this. And Shums is not part of the business school, rather he's part of our, School of Sciences, and bridging that gap between the sciences and business, and really kind of creating these like cool, curious connections of applying information from both of those into a single place. So really it kind of fits a lot with the thesis of Butler. And then Butler wants to get involved because we want to help these businesses actually solve for some of the problems that were discussed today already.
Yeah. Thank you so much. Yeah, I think we've definitely learned from everybody on this call how much of a wicked challenge the total cost of healthcare is right now. And so being able to have a thesis to be able to help attempt to innovate around that challenge, I think is super important and very much aligned with what you just shared about Butler's desire and entrepreneurship. So I know you briefly mentioned this, and I just want to make sure that I'm kind of, echoing this and making sure that it's, really kind of articulated on this call, is how do you envision students being involved with the accelerator? I know you mentioned a couple of different things in that introduction, so thank you for that. And then also just again, if you don't mind echoing or repeating yourself on what the students actually gain from this, because I think that's an important part, is as we're thinking about the future of healthcare and we're thinking about where we're going and future of innovation, is also how we make this, really an educational opportunity around that curiosity.
Yeah. And again, I think one of the things I've noticed, even in my short tenure in the entrepreneurship space, is people like to solve problems that affect them. And so oftentimes, again, especially in our undergrads, but we see it too in our MBAs, is a more kind of narrow perspective of experiences or problems that they faced. So one of the things that I love about things like this is it expands your worldview. I mean, yeah, I think some of us were even surprised by the statistics that were shared today, and we're in this field. So to expand their worldview of problems that can be solved. So I would say that that's another place that I think there's a benefit to the students, is seeing more than just, bad food in the cafeteria, or challenges getting to Target, or ways to, get food after hours, rather than how do I use all these neat skills that I'm acquiring at a university setting? And also, they have something that a lot of us don't have, which is time. Students have much more time, even though sometimes they say they're busy. They have much more time than other people. So the ability with which to kind of creatively and innovatively use that time to solve for real problems. There's nothing that I think stands out on a resume. I always tell students that, if they're at a dinner party and they're talking about their experiences, is it something that, they're on the other side of that table, someone's nodding and interested, and you can tell a story of something real and compelling that you did. And these really kind of offer our students as opportunities to do something real and compelling, and really kind of help people out. And so where you're going to see students is everything from they're going to be helping sift through some of the pitches that you deliver here early and deciding which ones move ahead to the accelerator. I see students, again, if you look at every aspect of what we're looking at, we've got students in the science department that can validate research on biology and neuroscience, that are going to help validate the assumptions that are getting made on the data and the research. We've got marketing students who can, again, help design go-to-market strategies and social media, and how to share your message with your target market, how to develop a persona or an ICP. We've got finance students who, again, can do pro formas. We've got accounting students, and again, that's my least favorite thing in the world, of how do you set out scalable accounting procedures for an early stage business, and how do we think through the potential tax advantages of setting up a business one way or another. Supply chain, thinking of, okay, I've got this great idea, but how are we going to make it come to life? So using each one of our distinct functions and being able to pull those resources in is really how we see our students getting involved. Because I really want, again, value creation is number one priority for me. It's why a business succeeds or doesn't succeed, is how great can you create value. But at the end of the day, is I want to make sure it's a two-sided value arrangement with those participating in the accelerator, that their students get value, and I think I've spent a lot of time there, but also that you, as you're building your business, you're getting value from these additional resources at no cost. And I think there's no better way of doing that. And as somebody who did a few startups that didn't have these resources, geez, I wish I would have had that back then too. So a lot of available resources and horsepower as part of being a part of this group.
Yeah, Awesome. Thank you for sharing. I'm smiling because I have the honor and privilege of also working with students in a faculty setting, and I learn from my students every day, and I'm always inspired by being around students. So, students are just a fantastic asset in the sense that they bring so many wonderful ideas, and I think you
So
gain
smart.
so much from learning from them. Quickly, I know we've only got like a minute left, Nick. If you don't mind just sharing with the group, I know you kind of mentioned the students, the faculty, all the different assets of this. Butler University is wanting to support the innovators and the accelerator from lots of different community resources. Do you mind sharing just a few of those resources that will also be available to the innovators as part of the accelerator from our community?
No question. Yeah. So Butler is part of, again, what we're building. And then now in tandem with this, now we're just like again, if you think of like two bubbles, we're just now a connected bubble between this project and now Butler's resources. Is what we were building and continuing to build is let's say a platform or an ecosystem of resources available. So everything from legal resources to accounting, like professional CPA level accounting resources, to like entrepreneurs in residence, so higher level entrepreneurs who have done the thing. So individuals who have started the tech company, if you're looking at a tech solution, or individuals who have started out more of like a hard tech or physical product that you're selling. So individuals that can help there. But more than that, we also have relationships with investors as well. So people with dollars that can help fund some of these things. So leveraging the connections that we have. We have the on campus here at Butler. We have the IC, the SBDC in terms of kind of the Small Business Development Center, are also a resource that we're partnered with that can help that. Finding grants. I actually spent all morning with the IEDC, the Indiana Economic Development Council, who are helping, again, how do they get grant funding and small business like funding to some of these ideas that are actually solving real problems. So how do we pull in some of the ecosystem resources that we're developing from an entrepreneurship perspective and then bring that to you as part of the accelerator as well?
Great. Thank you so much, Nick. Appreciate you sharing about your vision for entrepreneurship and all that you're doing to be able to help build the next generation of innovators and healthcare innovators and entrepreneurs. So with that in mind, I want to transition over to actually a person who participated in one of the Parkview Accelerator programs in the past to really speak to how that experience and the challenge went for them firsthand. So it's my honor to welcome Mark O'Sullivan, CEO of Neurobell, who's going to talk with us a little bit more about how that participation and that challenge went for them. So welcome, Mark. To get us going, Mark, if you don't mind, could you share a bit about your experience, participating in the Parkview Accelerator?
Great. Yeah, nice to meet everyone. I suppose as a bit of background, I'm the CEO of Neurobell. We're an Irish company developing solutions for newborn brain monitoring and specifically seizure detection. So just to give a bit of context, 1 in 200 infants suffer brain injury. Sorry, mic was a little bit low. 1 in 200 infants suffer brain injury at birth, and untreated seizures in newborns is a huge concern for the clinical staff and has been shown to increase the risk of permanent brain damage. And specifically, the challenging thing with newborns is that their seizures are silent, meaning that they don't have any physical signs that they're seizing. So our device is this guy. It's basically a small pocket-sized EEG monitor that connects into the back of system that then goes onto the back of the baby's head. So it's a very simple system for recording brain activity, and then it provides real-time seizure detection. So it's the idea of trying to take what's typically a very specialist technology to the bedside. So that's what we do at Neurobell. And I suppose to date, we've raised about 2 million in private funding, about 1 million in grant funding. We currently employ about a team of 14, and we've completed our first in human trials in Ireland. So that's kind of a background to the company. But prior to all that, and back in 2022, we were lucky enough to participate in and eventually win the Healthy Mom and Baby Innovation Competition in Parkview. So I suppose looking back then, it was basically just a team of 1 or 2 of us. So winning that competition was a catalyst to try and help Neurobell grow and progress our business goals. And yeah, part of winning that prize was funding from Parkview towards a clinical trial at the hospital. But I think echoing some of the points that's been made today already, I don't think we can overstate the value of having a health system as an innovation partner and what we gained throughout the accelerator and after in terms of access to clinicians, access to some of the reimbursement data, some of the billing data, and that's hugely important. So yeah, that's kind of a background. In terms of some of the specific examples, I suppose what we gained from having direct access to Parkview. Firstly, I think just to mention on the technology side, so our product uses Wi-Fi, and although it worked well in, let's say, the engineering lab, we hadn't anticipated some of the challenges with getting IS approvals from a big health system like Parkview, and the challenges of adding a new device to a hospital network and all the different cybersecurity concerns that go with that. So partnering with Parkview and throughout the accelerator allowed us to troubleshoot some of these things, and it was painstaking and it was frustrating, but it was representative of the real world and the challenges we were going to meet when we were scaling the technology. So the kind of outcome of that process was we ended up having to do a design change and a product change, but that has future-proofed us, hopefully for the next decade or so at least. So in terms of having access to not just the clinicians, but also what I'm going to call the support teams that are in hospital systems that are available in Parkview for people who are doing the accelerator. And I suppose, again, just echoing some of the points that were made today, as you've already heard, there's no avoiding that reimbursement and healthcare economics are just huge factors in the success of any healthcare technology. But as an early stage company, it's very difficult to get your hands on real world data. So I know listening to Nick and Chums talk about their project, they've done a phenomenal job to get access to data, but a lot of that data that is publicly available is typically through Medicare or Medicaid, which again might not be the full picture. So partnering with someone with Parkview means that it allowed us to get access to some of their electronic medical record data. So we were able to query the entire medical record for previous years and gain an actual true representative understanding of the clinical need, of the current standard of care and the market size. And that's essentially what makes or break a business, I think, is does the real world data support the need for your device? And I can't I can't overstate how important getting access to that was. So yeah, that's kind of I suppose a reason as to why to do the accelerator. In terms of the benefit of it, if I haven't stated that enough, I think in terms of going on to fundraise and to build a team and to validate the clinical need, I don't think you can ever confidently say that you know the full picture. It's a continuous learning piece, and you're continuously refining your technology, refining your go-to-market, refining your business model. So getting involved in Accelerator is a great opportunity to do that.
Awesome. First of all, congratulations, Mark. And I'm really excited we got to see some of the technology. So fascinating. And congratulations, because I think I heard you right that when you entered the Parkview Accelerator in 2022, you were, I think, 1 to 2 people is what you said, and now it's
Yeah, we're
14.
Yeah, it's
And
quick growth.
yeah, and 3 million raised and now in clinical trials. So congratulations. And then I think, what I'm hearing is kind of a common theme too, from what I understand your technology to be too, is it's also preventative in nature, right? How do we bring some of that kind of monitoring to the home for seizures, again, to prevent some of the different areas? So again, this kind of common theme continues to exist throughout the conversation today. So again, congratulations and thank you for sharing that. One more question for you, and then I'm going to turn it over to Ethel, who's going to walk us through and the innovators through the actual challenge this year. If you were, one of the people listening to this now as either a startup or a company with an idea, what would you recommend that they do to get the most out of an accelerator? It sounds like you really got the most out of the accelerator. And so I'm just curious, because it is a really unique opportunity. So since you were so successful, would you mind giving a little hack for everybody on the call?
Yeah, I think it's one of the things of where being prepared is kind of your best tool. So I think we're very prepared in terms of when we were meeting with some of the clinical staff that we had prepared well in advance. We knew what we wanted to ask. We knew what we wanted as an ask out of them. So if you're going into a meeting, always have your ask prepared and try basically never to get to a dead end, I guess, is one of the things. So at least that, clinicians are busy people. They don't have a lot of time to give you, but when they do give you time, make sure, you ask questions that kind of get them engaged in it, and then try and have an ask at the end of it. So whether that's a connection to another clinician that they work with, or who would they recommend you speak to next. But in general, what I found with Parkview across the board was that kind of no ask was too big either. So that's kind of the piece. And I think if for anyone in entrepreneurship, I'm from an engineering background, so I'm a bit introverted and don't hugely kind of like to put myself out there, but I think when you're in entrepreneurship, you have to just kind of stick your neck out a bit. And I think the team in Parkview, they don't cut you off for that. It's kind of recommended that, the more you can try and gain from the system, the better.
Great. Thank you for that. I appreciate that. And that's always one of those hard things to do is if you don't ask, no one will necessarily
Exactly.
volunteer because they don't know, right? But that's always hard to put yourself out there and ask for that. So, well, thank you, Mark. Thank you for that inspiring reflection. Really appreciate that, hearing from someone who's gone through the process. And again, congratulations on your organization's success. And what I'm going to do now is actually turn this over to Ethel Massing, who is the Director of Innovation and Strategic Enterprises at Parkview Health. You've heard her name a couple of times throughout this call. And she is actually going to walk us through, before we close today, what the accelerator looks like this year, the kind of terms that can, what to expect as far as application, timeline, all the nuts and bolts that really are the next step. So Ethel, the stage is yours. I know everybody's very interested about what this looks like and learning from you now.
Well, thank you so much, Stephanie. We are so excited to be partnering with Butler and Hylant this year on this challenge. Thank you to all our presenters for their insights. It was very valuable today. And especially thank you to Mark. Mark's really the reason we exist here at Innovation. We are here to empower innovators and companies like Neurabel to move their technologies forward and improve their patients. So we just love hearing that success story and being part of it. And that's why this competition exists. That's what we're trying to do. So again, thank you to everyone who joined us on our webinar today. And I hope the participants watching are ready to help us solve this issue. And I'm here to help you understand how to get involved. So, again, we're excited to host the 2025 Healthy Care, Healthy Cost Challenge with our partners, Butler and Hylant. This challenge is really seeking scalable, forward-thinking solutions to reduce preventable healthcare costs and improve outcomes for high-risk populations. When we think more specifically about that, as you heard from the previous speakers, unfortunately here in Indiana, we're a pretty unhealthy state. We routinely rank among the top 10 least healthy states in the US. So as we initially looked at this challenge and where we should focus our efforts, it was pretty daunting. And we were so blessed to have the talented students at Butler participate in the data challenge to help us find some specific areas to tackle. So if you're an entrepreneur or innovative thinker, we're challenging you to think about some specific areas to provide solution. First of all are those solutions for our senior citizens, especially those who are at risk of experiencing falls and fall-related hospitalizations. Another one is those sedentary lifestyles that are driving up our rates of obesity, diabetes, and heart disease. Another area is that those third of adults who skip and delay care because of the cost. Well, that really ends up costing us on the back end. So it is a cost. So how do we get them more engaged in preventative healthcare services? And then really solutions that help provide care in our rural areas. Provider coverage is limited there. And again, those can lead to costly delays. So if you're participating in the competition, here's what you should expect. We've already opened the applications for the competition. We opened those on May 1st, and you can submit ideas all the way through June 22nd. Then we will be selecting semifinalists up to 10, which will be announced on July 7th. And from there, the teams will have a little bit of time to prepare for the innovation competition, which will happen virtually on August 28th. So those semifinalists will be pitching for a prize of $10,000, but also entry into our accelerator program. During that innovation competition, we'll pick 3 to 5 finalists to participate in that accelerator, which will happen from September 8th to October 31st. From there, then those finalist participants will come to Butler on November 20th for an in-person pitch day, and you are all welcome to attend both the innovation competition virtually and the pitch competition in person. So what can you win? Well, first of all, During the innovation competition, we're giving away a $10,000 cash award to help advance your idea forward. We're also offering an opportunity to gain high-level exposure to potential funders, adopters, and customers, and really giving you the opportunity to pitch to leaders at Butler, Parkview, and Hylant. Also, when you get into the accelerator, you heard some of the advantages from Mark, but you really do get those real-world partnership opportunities, exclusive mentorship, and connections to healthcare leaders. Also, financial modeling, marketing, and collaborative support from our other partners as well. Who should apply? Well, the short answer is anyone and everyone, and we really do mean that. In the past, we have had finalists who are high school students, providers that came in with just an idea, established entrepreneurs, and community organizations. This competition really is open to anyone with a great idea, as long as it aligns with this mission. So again, if you're a startup, a health system, a provider, a researcher, a student, someone in public health, a not-for-profit, a community organization, or just some kind of innovator, we want to see your solution. These solutions should aim to improve health outcomes in the areas that we've outlined, reduce healthcare spending, advance health equity, and be able to be piloted in Indiana, but then also scaled nationally. So, if you're ready to be involved, what do you do next? Well, first, sign up to join us at our next live event, which will be the Virtual Innovation Competition on August 28th. Registration is open now, and that's where the semifinals will be pitching for that $10,000. Also, if you want to learn more about our upcoming events, read more about the competition, or submit your ideas, scan this QR code and it will take you to our website where you can learn more. Last, I just want to thank everyone for joining today. We really can't wait to see your ideas and hope you join us for our next events. Thank you so much. Thanks to the presenters. We hope you have a fantastic rest of your day.